Yeah, yesterday we have dealt about the, especially we have dealt about the ectoparasiticides, the different classes, and also the mechanism of action and the toxicity. Of course, we are here to discuss about the anthelmintics. It's also one of the important chapter because this deals with the worms which are present inside the body of the animals. It may be a cattle, sheep, or goat. So, coming to the main title, that is the anthelmintics. They are the drugs used to kill the worm or expel the worm. So, the drug which is used to kill the parasite is called as the vermicide, or the thing which is used to expel the worms out of the body is called as the vermifuge. So the parasitic worms are, and this especially this is totally, it is against the helminths. Helminth is a very broad term, and they will be present in the gastrointestinal tract and maybe in the other tissues. Of course, the hydatid seeds and other things, they are present in the other tissues. So anthelmintics are widely used in the veterinary medicine, yes, both for the prophylactic purpose and also to treat the chronic and acute infections. And they help to reduce the worm burdens which are present in the animals. And also it is required for the maintenance of good health of the animals. And the worm load will be indicated by the egg count, especially in the feces. And coming to the a little literature, this word details about the these helminths, or they are also known as nematodes and consists of an important nematoda. That's important class nematoda. That's the broadest class. And the nematodes, commonly called as the roundworms, and if they are unsegmented, cylindrical worms or the tapeworms, and also the flukes. And they have got the cuticle, which is resistant to most of the physical threat. And both ends of the roundworms are usually somewhat pointed, and body is not metamorphically divided into the segments, just like the tapeworms. And with a few exceptions, the sexes are separate, and the life cycle may be direct or indirect with an intermediate host. And another thing is the nematodes. They form a very large and complex group of the pesticides, endoparasiticides. Already we have learned about the ectoparasiticides. Now we are going to learn about the endoparasiticides. So they are categorized into several orders, families, and many more. And of course, you might have learned all these things in case of the parasitology. So I will not go into the detail of all these things. So they are belonging to the phylum, that is the Platyhelminthes, and the phylum Platyhelminthes consists of two important class of the animal parasites, like cestoda, means they are all the tapeworms, and the trematoda means they are the flukes. And the class cestoda, it's also including the tapeworms, and the cestodes of the tapeworms are elongated endoparasiticides, elongated ones. Then usually the body consists of the head or the scolex and neck and a strobila, that is consisting of the number of segments or proglottids. You might have learned all these things, especially proglottids. And each proglottid usually contains one or two sets of the reproductive organs, and the tapeworms are the hermaphrodite, means both female and male characters are with the same type of the worm. So they require two or more coats for completion of their life cycle, especially the tapeworms. So almost all tapeworms of veterinary importance, so they are belonging to Cyclopilidae, and with exceptions in the order of Pseudopilidae. So they are belonging to different categories. And there is a diagram of the cestoda family. So this is, they have an organ known as the scolex, which is used to attach to the intestine. And this is upper part is immature proglottid. So the broader one which comes in between is called as the mature proglottid. So they have got the serrated structures, and this is the gravid proglottid. Means they will fall off as usually, and this is the genital pore. So the entire part is known as the strobila, and the upper part is the scolex. So the flukes coming to the this. So it's have got the testes, then uterus. That's why they are called as the hermaphrodites, and many more parts are there. It is got the uterus is the elongated organ, and of course they also got the ovaries, then seminal replicle, then vagina. Yes, that's the copulatory bursa and male gonopore. So this is the structure. So the class Trematoda means flukes. Trematodes, cestodes, and nematodes are leaf-like unsegmented, dorsoventrally flattened endo or ectoparasites, and their body usually contains the suckers, hooks, or clamps that attach these parasites into the exterior or internal organs of their host. And their life cycle, like those of the tapeworms, it involves more than one host. So they are polyhostic in nature. Then this is the diagram of a trematode. So as usual, it contains the mouth, then pharynx, esophagus, cecum, then the common genital pore, then it's also known as metraterm, then it has got the testes and also the ovaries, both ovaries, oviduct. So as usual, they are once again coming under the category of the hermaphrodites. So these are all the different varieties of the different flukes which are present, but many of them are not so damaging in case of cattle. Only few are there which are causing the damage to the cattle is concerned. And coming to the very brief, after finishing this very brief introduction about the helminths, we'll come to the Anthelmintics. So as usual, we have learned about the ideal characteristic of the Anthelmintics. Yesterday we have learned about the ectoparasites. So all these properties do have the similar thing. So an ideal anthelmintic should possess the following properties. Then it should have a broad spectrum of activity, means it should be effective against all the internal parasites, including nematodes, cestodes, and trematodes. As such, there are no such drugs very broad spectrum as in case of the antibiotics. They should be effective against gram-positive and negative, and also the acid-fast, etc. Here it is not like that. It includes nematodes, cestodes, and the trematodes, and it should be effective against both mature and immature parasites. Means mature and immature parasites, and it should have a wide margin of safety, that it should be toxic to the parasite but not to the host. So in case of anthelmintics, we are achieving this property because most of the modern anthelmintics, they have got very good efficacy, and they are effective in eradicating the helminths, but at the same time they are not toxic. The example is the fenbendazole. It is highly effective against most of the nematodes, but it is least effective on the host. So at least we are able to meet one of the criteria to be an ideal anthelmintics. And it should not interfere with normal physiological functions, development, or growth of the host. So this is very true in case of the few of the anti-nematodal drugs. But anti-cystodal and anti-trematodal, they are having little toxicity. And it should have no or short residue period in tissues, and it should have minimal withholding period. So for example, if you treat an animal with the ivermectin, so it will stay in the body of the animal for a minimum of 15 days. So it is got this very long withdrawal period. So, and also the ivermectin is secreted in little quantity in milk, and that's why it cannot be a very ideal anthelmintic. And the another thing is it should be very easy to administer to a large number of animals in a herd or the flock. So this is also easy administration should be there, and it should be economical also. See, many of the anthelmintics of the present category are not so economical, but the ideal anthelmintic should be very, very economical, and it should be compatible with food and other compounds. Then types of anthelmintics, depending on their primary action, anthelmintics are broadly divided into three groups, then anti-nematodal, anti-cestodal, and anti-trematodal drugs. So if you remember this thing, that's a great idea. And some groups of the drugs, example, there is a benzimidazoles, have broad spectrum of activity and are useful against many types of the internal parasites, Coming to the first category, that is the anti-nematodal drug, means nematode means it is a roundworm. So there are once again sub-classification, and this sub-classification is done depending upon the chemical structure and mode of action. Then the anti-nematodal drugs comprise of the varieties of the following classes. Like the first category is the benzimidazole. So benzimidazole means a class is containing the thiabendazole, albendazole, fenbendazole, mebendazole, oxybendazole, oxfendazole, then cambendazole, bluebendazole, and the carbendazole. So these are the benzimidazole. They have got a very characteristic benzimidazole ring, and changing the other structures in that particular ring will yield different type of the benzimidazoles. And the second category is pro-benzimidazoles. Like these are going to be converted to the benzimidazoles after entry inside the body in vivo. Then the examples are the thiabendazole, then netobiman, then thiopene. All these are pro-benzimidazoles. And the second category here means second main category. First is benzimidazoles, and the second main category is macrocytic like clones, or the antibiotic, means the antibiotic anthelmintics. Example is the ivermectins. So the examples of the ivermectin is the ivermectin, then doramectin, then eprinomectin, abamectin, and selamectin. Already we have learned a little about all these things in the antiviral drugs also. So the second category in macrocyclic lactones is milbemycins. So the classical examples are the milbemycin, then oxime, milbemycin oxime, and moxidectin. So these are the two important categories, ivermectins and milbemycin. So recently this moxidectin is introduced into the veterinary market, and of course it is very, very effective. But the cost wise it is little expensive when compared to the other drugs, so especially the ivermectin and the doramectin. Then the imidazole thiazoles. The examples of this category are the tetramizole, levomisole, then butamizole are the examples of this category. So they are effective against the different parasites of sheep, goat, and cattle. The fourth category is tetrahydropyrimidines. Tetrahydropyrimidines, example, the parental, morental, and oxental. Then the fifth category is, yesterday we have dealt about all these things, the OPC compounds, example, dichlorovas, trichlorphone, comphos, haloxine, crufomate, and naphthalopos. All these are the organophosphorate compounds. They were used once upon a time, but nowadays they are not so used as a internal parasiticides. Of course, they are also not used as the external parasiticides, except one or two. Whereas the piperazines like the piperazine and the another important drug which is effective against the heartworm is the diethyl carbamazine, and it's soluble as DC, diethyl carbamazine citrate. Whereas the sixth category is the arsenicals. The example is thiacetarsamide, melarsoamine, glycobiarsol, and arsenamide. So these are also one of the ancient anti-helminthic drugs nowadays. Because of their higher range of the toxicity, they are not so commonly used. And also the a few of the other characteristic of this drug are they are toxic in nature, and also the modern agents are less toxic. Hence, these agents are nowadays seldom used. But anyway, we need to learn about the major mechanism and the toxicity, dose, etc. Then the seventh category, you need to remember all these things. It's unavoidable for you. Then substituted phenols and salicylamide. Example is disophenol. It was available as the injection earlier, like Inca. This is very effective against the hookworms. And nitroscanate and the nitroxenil. So they are effective against the flukes. Then the clozentel. Clozentel is effective against the nematodes and trematodes, both nitroxenil and clozentel. Whereas the last category or the ninth category is the miscellaneous anthelmintics. Example is the phenothiazine, then trichloroethylene, then N-butyl chloride, toluene, then thiamclosilate, then thiolipine, dithiazine, iodide, and also the hygromycin B. These are all the miscellaneous drugs which are effective against the helminths. Then coming to the first category, that is the benzimidazole. The benzimidazoles constitute a large family of the broad spectrum anthelmintics, and they have a wide margin of safety and high degree of efficacy, and constitute one of the main groups of the anthelmintics used clinically. So the most benzimidazoles are sparingly soluble in water and are given orally as a suspension, or only few of the anthelmintics are available as the injection, or they are also used as the paste, powder, or the intramuscular injections, or sometimes the subcutaneous injections also. Very few drugs are there. Of course, most of the benzimidazoles are administered orally to the animals and birds. Coming to the chemistry, then all benzimidazoles do contain the same structure, that is 1,2-diaminobenzone ring structure that's present there, and the modification of 2 and or 5 position of the benzimidazole ring, it produces various derivatives with different anti-helminthic actions. So the benzimidazole group broadly includes the thiabendazole analogs, then also benzimidazole carbamates. So this is the chemistry of the benzimidazoles. So replacement of the thiazole ring of the thiabendazole by methyl carbamates produces the latest generation or newer generation of the benzimidazole carbamates. So they are, it's a combined terminology which have the broader spectrum than the higher potencies, complex metabolic pathways, and all these are the characteristic of them, and they have got the slower rate of the metabolism. So slower rate of the metabolism and the fast excretion also. So then mechanism of action of the benzimidazoles. Yes, of course, most of the drugs of this category do share the common mechanism of action, and they have got the vermicidal action, especially with many biochemical changes in the susceptible parasites. So they produce vermicidal action, not the vermifuge. Vermifuge means it is going to expel the drug, and in lower doses, of course, they may do that action. But margin of safety of most of the benzimidazoles is very high. The primary action of this drug is probably related to their ability to bind with the beta tubulin. Beta tubulin, a structural protein, just like the antibacterial action. So these are also going to act on the helminth and block the polymerization of the tubulin into the microtubulin. So this tubulin into microtubulin conversion is very much required for the growth of the parasite. The continual depolymerization at the other end leads to complete breakdown of the microtubule. Normally in the microtubule formation, it acts as one end, and depolymerization at the of the microtubule occurs the other end. So inhibition of this tubulin formation by benzimidazoles and the breakdown of continuous breakdown of this particular tubulin causes the disintegrated integrity and transport functions of the cells within the parasite and block all the cell division. So these are all going to block the cell division. So the binding up of the benzimidazoles to parasitic beta tubulin is relatively selective, as it occurs at much lower concentrations than those required for binding to the mammalian proteins. Then the binding up of the benzimidazoles to parasitic beta tubulin is reversible, because after sometimes the bond between the beta tubulin and also the benzimidazole parasite beta tubulin bond is reversible, and it's also saturable, means as the concentration of the drug increases, so the receptors will be saturated here. Then the other mechanisms of the benzimidazoles include the inhibition of the mitochondrial fumarate reductase enzyme. Fumarate reductase enzyme. This fumarate reductase enzyme is present in many of the roundworms. That's why these are going to block the fumarate reductase enzyme and block the glucose transport and uncoupling of the oxidative phosphorylation. So because of this thing, what happens? The oxidative phosphorylation, because of this particular thing, the parasite growth will be immediately inhibited, and the supply of the energy to the parasites become producing anti-parasitic action. So the energy supplying mechanism will be hampered, and hence the parasite is going to die. And the anti-parasitic action depends upon their contact time with the parasite rather than the dose. Suppose this is having a very proper meaning that the duration of the contacts with an anthelmintic is more important than that of the concentration of the anthelmintic. So to summarize the mechanism of action in very short, number one, these are going to bind with that of the microtubulin. Then because of this thing, the bacteria, this anthelmintic, this helminth growth will be arrested. And also blocking up of the fumarate reductase enzyme causes the other effect, especially this anthelmintic action. And therefore, they are more useful in divided doses than the single and dose. So most of the time, what you are going to do is here, instead of the single dose, if multiple doses are administered, then it becomes more and more effective, especially in case of ruminants, horses, and the drug is low, passing through the rumen and cecum respectively. This they are going to provide longer contact time. So deworming is one of the important process in case of the animals, and we do the deworming using the benzimidazoles, tetramidazoles, and many more agents which are suitable to that particular geographical area. Then resistance to benzimidazoles is noted in several species of the large animals, especially the large parasites. Then, so as usual in case of antibacterial agents also, the acquired resistance to the benzimidazoles usually develop due to the alterations in the beta tubulin isotopes gene expression. Then because of this thing, this produces the altered beta tubulin with low affinity or the binding of the benzimidazoles. So this is the resistance mechanism. So microtubulin structures will be changed, and also the acquired resistance is going to develop due to the alteration in the beta tubulin isotypes. That's why the drug is not going to act on such hosts. thus such parasites. Then coming to the first agent, that is the thiabendazole. Among the these bendazoles, benzimidazoles, thiabendazole, or it's also called as the spelling. Another spelling is this usually thiabendazole, whereas it can also be called as thiabendazole, thiabendazole. So this is the first benzimidazole introduced in about the 56 or 57 years back, and is considered as the prototypic drug for the broad spectrum benzimidazole. So it is very much selective against the nematodes, not the cestodes or trematodes, but some fungi are also being killed by this particular anthelmintic. Then also this is also having anti-mite activity. Mites are the one which are going to be helpful in case of these manges. Then it occurs as the odorless, tasteless, white to practically white powder, and it is insoluble in water and slightly soluble in some of the water content. Then this is the structure of the thiabendazole. Then it's available as 5% wet ball volume, the plastic squeezing tube, and also it is available as the tablet, and also sometimes the suspension is also available. Then coming to the anthelmintic spectrum, usually this is a broad spectrum because it is effective against almost all the major nematodes of the sheep, cattle, and the goats. So coming to this thing, so anthelmintic spectrum is a broad spectrum in nature. Then its activity is against majority of the GI nematodes of sheep, cattle, goat, and horses. This is also one of the important points. So the important points of the ruminants include the homunculus. Homunculus means the blood-sucking parasite. Then Strongyles is the one of the important blood-sucking parasites. Then apart from this one, the other helminths are the bunostomum, then Ostrategia, then Nematoderus, then Usophagostomum, then the posteriostomum, and many more, especially the oxyuris. And the thiabendazole is also indicated in swines, the Ascaria suum, that's the roundworm of the young pig, and the Strongyles, Ransomi, and the dogs against Toxocara canis. Of course, these Strongylids and phylorid species. So that means it is having the very wide or broad spectrum nature, whereas it is less effective against the lungworms and whipworm. The reason being, it is not absorbed properly into the circulation, and the concentration which is present in the blood is not effective against the internal parasites, especially other than the intestine. So this it's normally mainly effective against the mature worms, but also to some extent it is effective against the immature and migrating larvae. So the thing is, this is effective mostly against the mature worms, but sometimes it is also effective against the migrating larvae. And development of parasitic resistance to thiabendazole in some of the geographical area has reduced its efficacy. That means we should follow the rotation pattern, or else the worms will get resistance to the anthelmintic. Coming to the kinetics, as usual, the thing is most as this characteristic of this benzimidazoles, it is absorbed rapidly after oral administration and reaches peak plasma concentration in about 2 to 7 hours. Then After absorption, it is distributed throughout the body tissues. So, like any other benzimidazoles, both absorbed and unabsorbed part, they are having the enthelmintic action. So, after metabolism to 5-hydroxybenzimidazole, the thiabendazole is excreted mainly in conjugated excretion, especially in the bile and also in the feces. So, the mechanism of excretion is conjugated excretion in the bile, and also later it is going to be excreted through the feces, and complete excretion of the drug occurs within 5 days of single oral administration. Then the side effects or the adverse effects. So most of these benzimidazoles, they have got a very wide margin of the safety, except the albendazole and the drugs, but most species and they are usually well tolerated at the recommended doses. So in case of dogs, what we can see is vomiting, diarrhea, hair loss, and lethargy are occasionally seen, and particularly after repeated administration of the high doses. So repeated administration of the high doses may cause the lethargy, whereas the dash hunt dogs are more susceptible to the adverse effects of the thiabendazole when compared to the other breeds. Hence, they need to be dewormed with the other anthelmintics than the thiabendazole. Of course, the fenbendazole is a better choice in that aspect. Then the contraindications, in which situations it should not be used. So there is no absolute contraindication of the thiabendazole in domestic animals, especially in case of the dogs. So you have seen that these dogs, especially the dash hunt dogs, are little susceptible. Hence, just you need to you should not prescribe this drug to the dogs. But the side effect is rare, and the drug interactions, thiabendazole is used mainly in case of the large animals for the treatment of the helminthiasis, especially the strong gales, and this is caused by several blood-sucking parasites. Yes, in case of dogs, it is used only systemically for treatment of the strong gales, and apart from this one, the phylloids. So Filaria, Diarofilaria mitis, and the Thelegia rhodesi, etc. They are having the phylloid activity, and the thiabendazole is highly effective against those parasites. In dogs, this thiabendazole is more commonly used typically as an anthelmintic and also the antifungal agent. So this is some important antifungal activity of the thiabendazole. So thiabendazole is available in the variety of the dosage forms, like the suspension #1, then the bolus, single individual bolus, then the feed premix, then few of the pastes are also available, and top dressing above the pellets. So these are the therapeutic uses or the dosage forms, especially the thiabendazole. Then those may be needed to be repeated in pigs and dogs, while single doses are effective in case of the ruminants. Usually what we'll do is we administer a single dose and forget, but it has 0 days with withdrawal period. That's the greatest advantage of this drug. It is got the 0 withdrawal day. The next day you can send the animal to slaughter, and also the milk can be consumed very safely. So the how to remember the doses? Usually it starts with 50 to 100 milligram, especially the helminths, the cattle 50 to 100 milligram per kg, and it is administered as a single dose. So it is not a long-acting drug, but in spite of that thing, it is effective in the single dose. And in case of horses, half the dosage recommended in case of the cattle, and this should be used as a single dose. Whereas in case of poultry, this is 250 to 500 milligram per oral as a single dose is recommended, and may be repeated in 10 to 14 days. Please remember that. Suddenly it should not be this repeated, then you should take the 15 days to 14 to 15 days, the standard time to re-administer the drug. So it is 0.5% in feed for 10 days. It will be there, especially in case of the poultry. So that's the 5%. The 0.5% should be the premix, especially in the cattle feed, also the poultry feed. Then albendazole is also another agent, benzimidazole. Then it's also the methyl carbamate. So that's the antibiotic. Then it is widely used in veterinary medicine for the treatment of nematodes, trematodes infection, both anti-trematodal and also a weak anti-trematodal. So it is effective against most of the gastrointestinal parasites, especially of the cattle and other ruminants, including the varieties of the helminths like Austrategia, Haemonchus, then Tricho, Strongylus, then Couperia. Yes, the list is very, very big, Bunostomum, Mesophagostomum, etc. So it is effective against. And it's also active against the Dictyocalus. This type of the worms, especially they are called as the lung worms. So they are embedded in the lung of the cattle, and they require the concentration of the drug to come in case of the lungs, so that the tapeworms and flukes, this drug is effective, especially in case of flukes. Hundreds of varieties are there. That's why the fasciola hepatica, which causes the severe liver damage. Then, so in dogs, albendazole has been used for treating the filariasis infection, and cat is that's used widely for the treatment of intestinal helminth infections. Then also they are effective against the hydatid cysts and also the cysticercosis. So cysticercosis, the hydatid cysts are formed. So this albendazole is one of the drug that is effective against the cysticercosis also. Then albendazole is the very well absorbed, that is 55%. Of course, it is 55%. Then it is effective against to the extent of 55% oral administration, but absorption is inconsistent in some of the cases. Whenever there is a food, especially in the intestine, very less absorption occurs. Whereas after absorption, it is reversibly converted by first pass metabolism. So first pass metabolism is also known as hepatobiliary metabolism, and it is converted to sulfoxide metabolite. It's albendazole sulfoxide. So this is further metabolized into the sulfones. Sulfones are some of the bactericidal drugs. Then the albendazole sulfoxide is active and produces the anthelmintic action. Especially albendazole is converted to albendazole sulfoxide. Then it is very effective and produces the anthelmintic action. Then the benzimidazole sulfoxide is widely distributed in the body, including the central nervous system. So the parent drug and its active and inactive metabolites are also excreted, especially in the urine. So albendazole is very well tolerated in the recommended dose. Well, and it is having little margin of safety, means wide margin of the safety, that it is tolerated by the hosts, especially the cattle, sheep, goat, and pig. Then dog may develop anorexia, then myelosuppression, and cats may exhibit symptoms of the lethargy, then depression, then sometimes the anorexia, and sometimes the drastic weight loss, and there is a decrease in the neutrophils, that's neutropenia, in high doses or the prolonged administration. So the albendazole has been shown to be teratogenic. It is shown to be teratogenic, but it is not recommended during the first trimester of the pregnancy. Usually it is not going to cause any abortion, but there is a chance that it may cause the fetal abnormalities. So it should not be used in case of pregnancy. The drug is not approved for the use in case of the lactating dairy cattle. This is a very, very funny matter because most of the albendazole that is supplied to the animal husbandry department is given to the animals which are lactating in their lifespan. And albendazole is available in an oral suspension and as an intraruminal bolus for the ruminants. Directly it is placed in the rumen bolus with a very specified equipment, special equipment. Then, of course, this is the structure of the albendazole. So it is having the characteristic benzimidazole ring inside, and the outside varieties of this are being joined. Then the dose for roundworms and tapeworms, usually the dose is 7.5 to 10 milligram. This is the range. If you remember, that dose of the cattle is ranging from 7 to 10 milligram. That is the goats. It is a little bit more drug is required when compared to the sheep, and swine it is thiazole 5 to 10 milligram per kg orally. Whereas in case of the suspected anti-flukes or the flukes or adult flukes, so this drug is going to affect the adult flukes only. Then cattle it is administered as the 10 milligram per kg tablet. A heavy cattle is maybe weighing 400 kgs, so you may require the 4000 milligram of the drug. So in case of sheep, it is 7.5 milligram per kg. Then for filariasis and other parasites infections, the dose is 25 to 50 milligram per kg. It is usually administered, 99% it is administered as the oral preparation. Okay. Just wait for 2 minutes, I will come. So the dogs, the dose is the 25 to 50 milligram per kg, whereas in case of cats, it is 25 milligram per kg, and it has to be administered 2 times daily for 10 to 21 days usually. So for in case of filariasis, because the drug need to enter into the bloodstream, and that's why it need to be administered orally. So the dose range from 7.5 to 10 milligram, very similar to that of the thiabendazole. Whereas the higher dose, of course, it is there 25 to 50 milligram. You can remember. Whereas the fenbendazole is one of the most commonly used drug, benzimidazole. In veterinary practice, the fenbendazole is a very broad spectrum benzimidazole, and it is one of the most safest anthelmintic, especially in the benzimidazole group. So it's active against almost all the important forms of the nematodes, like the companion animal, farm animal, zoo animal, horse, etc. So it has been used in bitches against tissue-dwelling larvae of the Toxocara canis. So you know the life cycle of the Toxocara. So usually the eggs of this Toxocara canis are laid, then it is swallowed by some of the other dogs. Then what happens is the larvae are going to penetrate the intestine, then they enter the liver, then they penetrate upwards, then these are going to lungs. Then when the animal is having the cuff, they will be once again entering the esophagus. Then, so it has been used in case of the beaches, especially in case of Toxocara canis and Ankylostoma caninum. So the hookworm prior to the whelping. So this prevents the worm load, especially in the pups, and it's also active against the Giardia infections, especially in case of the ducks. And fenbendazole is only marginally absorbed, just less than 5% it is absorbed. Then the systemic effect is almost nil, and it is having the wide margin of the safety. This fenbendazole is having very wide margin of the safety. So particularly the drug is effective against most of the nematodes, especially in case of the animals, as you already know it very well. Then, so the drug, especially the fenbendazole, is such a wonder drug that many times this is effective against the most of the helminths, and sometimes a few of the drug is effective against few of the fungi. And apart from this one, of course, the margin of safety is very high. Then this drug is effective, especially in case of the adult as well as the immature and the mature flukes. Then so coming to the drug as such, so okay, so fenbendazole is safe and very wide margin of the safety. Of course, you are this, and cattle with heavy lungworm infections may show some allergic reaction to the fenbendazole, and mainly due to the release of the antigens by the parasites which are dying. So most of the drug is unchanged, and similar to albendazole, the absorbed fenbendazole is reversibly metabolized to the active compound fenbendazole. Then the source of fenbendazole sulfoxide, or it's also known as oxfendazole, and is further oxidized into the sulfones. So most of the unchanged fenbendazole is excreted in the feces, hence it is effective against most of the worms which are present in the animals, especially in the intestines. Whereas in case of ruminants, it is going to undergo the enterohepatic cycling, which prolongs its duration of the action. So among the bendazoles, the fenbendazole is most safest in its efficacy, and the gastrointestinal disturbances like the rare, like vomiting, may occur rarely in case of the dogs and cat receiving the very high dose of the fenbendazole. And fenbendazole does not have the embryotoxic or teratogenic effects, and safe in case of the pregnancy. So nothing is going to happen. So you can administer it to all classes of the animal, whereas the thiabendazole should not be administered, and albendazole within 3 months of the pregnancy. So the withdrawal period of the fenbendazole is 14 days for the meat and 72 hours in case of the milk. Suppose you administer the fenbendazole to an animal, you should not slaughter it till the last dose of 14 days, and you should not use the milk till 72 hours of milking. And the drug is not approved for the use in case of the lactating dairy cattle or food animals due to the longer residual period. So that's the only disadvantage of this drug, because it is very, very safe. Then having very least adverse effects, everything is okay, not contraindicated in pregnancy, but it should not be used in case of lactating dairy cattle and the other animals because of the longer residual effect. So the fenbendazole is available as the bolus, then 150 milligram bolus tablets like Penacure. It's one of the most common brand, and the Penacure is also available as the 1.5 gram and 3 gram bolus. So the dose is dogs, it's a 50 milligram per kg orally for 3 days, especially in case of the lungworm, because it is not going to be absorbed to the greater extent. Of course, in case of cattle, it is very less. Dose is 7.5 milligram per kg. It's enough. So the dose of the benzimidazoles is in the range of 7.5 to 10 milligram normally in most of the animals, and in case of lungworm infection, then only the dose need to be increased to 5 times. That's 50 milligram per kg. And in case of sheep, goats, and pigs, it is 5 milligram per kg as a single dose. Then the horses 5 to 10 milligram per kg as a single dose. So this is also effective against the larval stages of the parasites, especially the migrating large strongyles. Of course, the dose need to be increased. That is 50 milligram per kg orally for 3 days. And birds also, the birds like the Syngamus tracheae and many more helminths are there, and it is effective against the dose of 10 to 15 milligram per kg. But it need to be administered for 10 days. Whereas in case of cattle, it's single dose. Then mebendazole, mebendazole is very commonly used in the human, especially in case of the kids and the children. So it is a broad spectrum benzimidazole, anthelmintics. So it is effective against the GI nematodes of the horses, sheep, dogs, and cats. And it has some anti-filarial activity also. Of course, the mebendazole is relatively less absorbed when compared to the other drugs. After oral administration, then also fatty meals increase the absorption, less than 10%. Of course, the fenbendazole or the mebendazole, they are very absorbed very poorly. Then mebendazole is generally well tolerated at recommended dosages, although the abdominal discomfort is there. So, but these are all a rare phenomenon, occasionally, not a common phenomenon like the anthelmintics. The mebendazole is not recommended in the pregnant animals because it has shown to cause the embryotoxic and teratogenic activity. In case of the experimental animals, especially, it should never be administered to the pregnant animals. And the dose in case of dogs and cats, the 25 to 50 milligram for 5 days, and sheep 10 to 15 milligram, horses 5 to 10 milligram as a single dose, and poultry need to be administered for 3 doses as 10 milligram per kg body weight. So this is the structure of the mebendazole. Then oxybendazole is another broad spectrum anthelmintic with activity against the GI roundworm, that's the sand lungworms, and it is mostly employed in case of horses, but can be used in cattle and the other animals like the sheep and the swine. And a combination product of the oxybendazole and diethyl carbamazine is available for the dog, especially oxybendazole and diethyl carbamazine citrate is used for the dog heartworm diseases. So the therapeutic index is oxybendazole is 60 times the recommended dose has been mentioned for the horses. That means it's a wide margin of the safety. Then there is no evidence of the embryotoxicity, hence the oxybendazole may be used in case of the pregnant animals. Then the dose is the horse 10 milligram per kg orally as a single dose. That's the 15 milligram per kg for strongolids, the dose. And the cattle and sheep 10 to 20 milligram and swine 15 milligram orally. So this is the structure of the oxybendazole. It is somehow similar to that of the fenbendazole and mebendazole. That's the oxfendazole. is a broad spectrum benzimidazole anthelmintic, and the sulfoxide metabolite of the fenbendazole. This is the oxfendazole. So it is active against many roundworms and their larvae, and also certain tapeworms. So it is used in horses, there's cattle, sheep, goat, and swine. So unlike many benzimidazoles, oxfendazole is absorbed more readily from the GI tract. So once in blood, oxfendazole recycles across the gut wall between the vascular system and also the GI tract. So it is because of this thing, it is having longer duration of action, the oxfendazole. So the both absorbed and unabsorbed part of the oxfendazole has been, they have got the very good efficacy against the GI nematodes, and vice versa, the active compound fenbendazole and the sulfones especially. And most of the drug and its active or the inactive metabolites are excreted in feces, most of the drugs. So the oxfendazole is well tolerated at the recommended doses. So nothing is going to happen. Oxfendazole. So dose is 10 milligram in case of horses, sheep, and goat. So it is used as a single dose remedy for majority of the helminth disorders. Then cambendazole is a broad spectrum anthelmintic with activity against the roundworms, mainly the tapeworms, and also some of the tapeworms. Roundworms mainly, but it's also effective against the tapeworms. And it is unlike most of the bendazoles, cambendazole has the narrow margin of safety, and it's producing the embryo toxicity in pregnant animals, hence it should not be administered. So it is very lessly used nowadays, and of course the dose is in the range of 20 milligram to 40 milligram in case of the swines. The structure which is having the methyl structure, especially here in the left side. Then the flubendazole is another broad spectrum benzimidazole used mainly in case of pigs and the birds, and it is active against the GI roundworms and also the lungworms in swine, and the gapeworms, or it's also known as the Syngamus tracheae in case of the name birds, and also they are effective against the lungworms. So the flubendazole is very poorly absorbed from the GI tract, and hence got very low toxicity because of the poor absorption. So the dose is the pigs 5 milligram per kg as a single dose, and poultry is 30 gram per ton of the feed for 7 days, especially for the roundworms, and of course 60 gram per ton of the feed for the tapeworms in case of the poultry. So the flubendazole, the fluorine moiety is present here, if it's flubendazole. Then carbendazole is another broad spectrum benzimidazole, and it is effective against many GI roundworms, and once upon a time it was very popular in the name of the hell attack. It's the trade name, and many shepherds used to drink this drug to the sheep, and but it is very embryotoxic and teratogenic in nature. So its teratogenic effects, especially the skeletal malformities, have been demonstrated in sheep at dosages much lower than the dose associated with acute toxicity. So you need to remember the name of the drugs which are causing the toxicities, especially the teratogenic effect and also embryotoxic effect. So the dose is mentioned below. It's carbendazole structure. Then few of the benzimidazole prodrugs like the carbamates is one of the benzimidazole prodrug. They are inactive in vitro, whereas they are produced as benzimidazole when they enter inside the body or in vivo. So all other things are very similar to that of the benzimidazoles. So it's a Favental is the benzimidazole prodrug that is metabolized in vivo to the fenbendazole and oxfendazole. So because of this thing, it is effective in most of the drugs, and it is what insoluble in water but soluble in alcohol only. Coming to the mechanism, it is same to that of the fenbendazole. So the tubulin and microtubulin are formed, and these agents block beta tubulin. Then fumarate reductase enzyme is inhibited and prevent glucose utilization, especially in the susceptible worms. So the spectrum of activity, nothing more to discuss. It's very similar to that of the metabolites, especially the fenbendazole. Of course, it is effective against the small and large strongyles, ascarids, and pinworms in horses, and also in case of cattle. So it is in dogs, it is effective against the hookworms, that is Anthelmintics caninum, and also the roundworm, that is Toxocara canis, and also the whipworms, that is Trichuris vulpis, and the tapeworm, Diphyllidium caninum, and the Tinea fisiformis. So these are all the drugs. And in case of cats, it is effective in removing the Ankylostoma tuiforme and Toxocara cati. Then in ruminants, it may help to improve or remove the abomasal and intestinal nematodes. Of course, the lungworms and trematodes. All other properties are very similar to that of the fenbendazole. And kinetics, so it is absorbed from GI tract and rapidly metabolized to fenbendazole, oxybendazole, and fenbendazole sulfoxide. All the three are having the good enthelmintic activity. The PPC or peak plasma concentration will be in 66 to 12 hours after the administration, and of course 12 to 24 hours in case of the cattle. And side effects, it is well tolerated, and there will be transient salivation and diarrhea, vomiting, and anorexia may be seen in very large doses. The side effects are usually mild and self-limiting. Of course, any of the anthelmintics do not have the serious side effects or life-threatening side effects. So the combination products of the favental and praziquantel in case of horses produce salivation, then sometimes the mouth irritation and diarrhea and colic. And favental should not be administered to pregnant animals because it result in the increased abortions. So the fetal abnormality, this is very, very alarming. Like it is going to cause abortions. The farmer will never worry about anything. If the drug is going to cause abortions, then it is very, very dangerous. So what happens is many times the farmer doesn't know that the animal is pregnant. And so if you administer without parental examination and confirming the pregnancy, then it will be a bad practice, or iatrogenic abortions may also be caused. Hence, one should be careful. Then clinical uses, as usual, it is very similar to that of the benzimidazoles, like GI roundworms in the horses, ruminants, pigs, and pigeons. So the combination of the favental and trichlorphon is used in the horses for control of mouth and stomach stages of the bot flies. That's the Gastropilus species. So along with the praziquantel, a anticestodal drug, favental is used mainly in case of dogs and cats for the intestinal parasites like the hookworms, then whipworm, and the tapeworm. So the dose is same, 7.5 milligram to 30 milligram. So of course, it is also in combination with the praziquantel, the dose is little less. Then netobimin is benzimidazole prodrug. Almost all the properties are similar, but its active metabolite is albendazole. So nothing more to tell here. It is all the activities are very similar to that of the albendazole. So it is well tolerated and also effective against the lungworm and adult slugs. So 5 dosage of netobimin produce the same thing, the embryotoxic and the teratogenic effect. So it is not used by the FDA for the pregnant animals during the first trimester of the pregnancy, whereas the fenbendazole is okay, whereas the albendazole is also not recommended. So the dose, as I already told, the dose of most of the benzimidazoles and products 7.5 to 10 milligrams. Of course, here it is cattle sheep 20 milligram per kg oral. And thiophanate is a prodrug like the low-bendazole. So it's active against most of the roundworms of the ruminants and pigs. And thiophanate is very safe at very high doses. So here the cost wise it little may be high, and the cattle, sheep and goats it is 50 milligram per kg as a single dose, and it is used as 2.8 kg per ton of the feed, and pigs of course 5 to 12 milligram. The rest it can be mixed in the feed as 150 to 450 grams per ton of the feeds and administered for 14 days in case of the pigs. So the next is the macrocytic lactones. Tomorrow we can discuss this thing.